All right, moving on. We're going to go ahead and start talking a little bit more about the hamstrings, the tensor fascia lata, and the iliotibial band. Now, I strongly recommend that we do not adjust to the back of the knee, okay? There are arterial structures back here, venous structures back here. We really don't want to impact. I strongly recommend that we do not approach these areas as far as the adjusting instrument is concerned. Not that we've had any bad instance that would preclude us from the warning, but the fact is, this is just common sense and clinical sense that says that these vessels don't need to have any kind of percussive impact to them. So we're going to go ahead and start off with the hamstring. What I tried to do is explain to the patient that the hamstrings are part of their low back. It's a two-way hinge as far as the low back is concerned. If we can loosen up the hamstrings, a lot of times we can reduce tension as far as the low back is concerned. So what I explained to them is we're going to start at the base of their buttocks. Remember, stay out of the midline. This is a violation area. So what we want to go ahead and do is just start at the gluteal fold, and we can go ahead and start giving some impact. Always have your second hand, your free hand, connected with the human body, okay? Very important for patient safety and for security for the patient that they know exactly what you're doing and why you're doing it. And that's why explanation is always very important. Hey, we need to go ahead and reduce some tension as far as the low back is concerned, and one of the associated muscle structures of the low back is the hamstring muscle. Is it okay that I work with that? Excellent. Always ask for patient permission. It takes 2 seconds and it can avoid a lifetime of lawyers. So the fact of the matter is we want to always get patient permission and make them feel as comfortable and as secure in what we're doing as possible. So starting at the gluteal fold, we're going to go ahead and give her some impact. Now this is full bore. This is a large muscle group, and we're not down on a bone, but we're just working the muscle belly a bit. And we're working here at the gluteal fold, and we work around. Then we can go as far as the muscle belly itself, and again I give it some support. Okay, try not to just pinch the muscle, just give it a little bit of support. And then above the knee, okay, we're not going to the back of the knee, but above the knee, we can bring the tissue in a little bit, work that a little bit, and again, in the lower portion of the hamstring. We're not adjusting the back of the knee. I can't say that enough times, okay? So working with this area, this is the hamstring. Working on the lateral portion, we can start working the tensor fascia lata, or the TFL, and we can start going laterally and doing more like we do a regional adjustment, and we can go right down to the IT band. And we start working a little bit forward, a little lateral, a little bit in here. And again, just trying to stay away from the back of the knee here, we can effectively work the tensor fascia lata. Now there's a lot of people that will come in and they have this thing so tight it's like rock. What we really want to focus on is loosening that up the best that we can. Sometimes when we go to the IT band, the iliotibial band, we'll start running into patients that have a lot of tenderness. So what do we do when we're tender? We back it off. We put the screw down. We get down to that 25 pounds per square inch, about halfway down at least range, and that's a lot easier, and less is more in this region sometimes. What I just try to expect is that the patient comfort is above all else in these adjusting procedures. So we've covered the hamstring, we've covered the tensor fascia lata and the IT band. We're going to go ahead and work on going on to the next section.